Body fluids and circulation, rapid revision. So first let's see the features of human heart. It is myogenic. It means what? It can work by itself, that is without the help of nervous system. Okay. So if the heart is working with the help of nervous system, such a heart is called as neurogenic. So two types of heart is there. One is myogenic, which can work by itself, and the human heart is myogenic. And the other type is neurogenic, which is working with the help of what? Nervous system. Okay. And this is seen in invertebrates, that is some kind of arthropods. And then tetra-chambered. The human heart is tetra-chambered, that is 4 chambers are there. 2 upper chambers called atria or auricles, and 2 lower chambers called ventricles. Okay. So this is the left atrium, and this is the right atrium, and then this is the left ventricle, and this is the right ventricle. Okay. And then the left ventricle, it has thickest wall because from there it is pumping to different organs. And then it is covered by a double walled what? Pericardium. And then human heart beats about 72 times per minute. That is, the heart rate is 72 times. And then the cardiac output, stroke volume into heart rate. What is the stroke volume? It is the volume of blood pumped by heart in one cardiac cycle. Okay. One cardiac cycle, and which is about 70 ml. Clear? So the stroke volume is 70 ml, and it is a volume of blood pumped by heart in one cardiac cycle. And then the heart rate is, we know, it is 72 times, right? So the cardiac output is, it is the volume of blood pumped by heart in what? 1 minute. So cardiac output, that is the volume of blood pumped by heart in 1 minute. So the stroke volume into heart rate, that is 70 into 72, which is about 5000 ml or 5 liters. Okay. Then the conduction system, SA node is the pacemaker because from there the impulse is generating. And then AV node, it is called as, AV node is called as pace setter. Okay, pace setter. And then the impulse pathway, I told you the impulse is generated within the SA node. So this is the SA node. And then this is the AV node. Okay. And then the bundle of His is here, and then Purkinje fibers. So from SA node to AV node, and then from AV node to where bundle of His, and finally to Purkinje fibers. So this is the pathway of impulse. Blood vessels, arteries and veins are there. Arteries carry blood from heart to different body parts, and then veins carry blood from different body parts towards heart. Okay. And the arteries carry oxygenated blood except the pulmonary artery. All veins carry deoxygenated blood except what? Pulmonary veins. Then the aorta, that is the largest artery. And then vena cava, that is the inferior vena cava. Inferior vena cava is the largest vein. And then the next difference, the veins, they are provided with valves. What is the significance? To prevent the backward flow. Okay. Why? Because the veins, it has large lumen, large cavity when we compare with the arteries. So since the lumen is very large in veins, the blood pressure is less. So as a result, there is a chance to backward flow. And this is prevented by the valves. And while the arteries, since the lumen is very less and thus the pressure is sufficient there, so no chance to backward flow. The arteries are not provided with valves. Next about blood, it is a fluid connective tissue. And then the pH is about 7.4, that is slightly alkaline. And then the average blood volume is 5 to 6 liters. And then the components of blood, it consists of the liquid part. The liquid part is called as what? The plasma, which is about 55%, and the solid part, that is the blood cells or formed elements, which is about 45%. Okay, the plasma, it is a straw colored fluid, and 3 proteins are there. One is albumin to maintain the osmotic pressure, and then globulin to provide immunity, and then fibrinogen, it is involved in blood clotting. Then about RBC or erythrocytes, it is biconcave like this, and then enucleated, that is what? The nucleus is absent. But immature RBC, that is erythroblast. This is the immature form of RBC. Sorry, not erythrocyte, erythroblast. Erythroblast. This is the immature RBC. And this is what? Nucleated. But HB is absent. This is the difference. So immature RBC, that is the erythroblast, that is nucleated, but hemoglobin is absent. But mature RBC, it is called as what? Erythrocyte, where the nucleus is absent, enucleated. Okay. But it carry what? Hemoglobin, and thus possess oxygen carrying capacity. And then the destroyed mainly in spleen and the pigment which is involved in transportation, that is the hemoglobin. And WBC or leukocytes, they are the body's defense cells, and neutrophils are the most abundant WBCs. And then the lymphocytes, it is involved in the production of antibodies. Two types of lymphocytes are there, B lymphocytes or B cells and T lymphocytes or T cells. Then the monocyte, they are phagocytic. Then eosinophils, it defend against parasites and also involved in allergic reactions. Okay. And then basophils release the histamine, which is a vasodilator. That means it dilates the blood vessel. Okay, so this is a vasodilator. And then the heparin, that is anticoagulant. That is, it prevents the coagulation or the clotting of the blood. Anticoagulant. And the classification of WBC, that is two types. Granulocytes if granules are present, and agranulocytes if granules are absent. Granulocytes are of three different types, that is neutrophil, eosinophil and basophil. And the percentage, the neutrophil, it is between 50 to 70%. And then eosinophil, it is 1 to 4%. And the basophil, that is 0.5 to 1%, less than 1%. Okay. And then so the most abundant WBC, that is the neutrophil, and the WBC which is present in least amount, that is basophil, which is only less than 1. Okay. And then agranulocytes, they are the lymphocytes and then the monocytes. Lymphocytes about 20 to 40% and the monocytes about 2 to 8%. Then the nucleus, the neutrophil, it is multi-lobed nucleus, and eosinophil bilobed, and basophil, it is S-shaped. And then the lymphocytes, large round nucleus, and the monocytes, it is kidney-shaped nucleus. And these are the different functions. Okay. Platelets, it is involved in blood clotting. The platelets are formed from the special cells which is seen in bone marrow, and they are the megakaryocytes. Then the blood groups are on the basis of the type of antigen. If antigen A is present, that group is called as A group. And if antigen B is present, that group is B group. And if both antigens A and B are present, it is called as AB group. And if antigens are absent, it is O group. Okay. And then the O group is the universal donor or negative, that is the universal donor. And AB group is, or AB positive, that is the universal recipient. And the next is Rh factor. And Rh factor, this was first discovered in rhesus monkey. And if Rh factor is present, they called as positive group. And if Rh factor is absent, they called as what? Negative group. Okay. Then what is the difference of this Rh factor when we compare with this AB group system? In case of AB group system, natural antibodies are there, right? That is, if antigen A is present, then antibody is B. And if antigen B is present, antibody is A. And if both antigens are present, antibodies are absent. And if both antigens are absent, both antibodies are present. That is, A as well as B is there. Okay. But in case of this Rh factor, no natural antibodies. That is, the antibodies will be produced only when the negative blood exposes to positive blood. Okay, so this is the difference between Rh factor and ABO group system. Humans have double circulation since the blood is flowing through heart twice in one circulation. And humans double circulation since the blood is flowing through heart twice in one circulation. And then no mixing of oxygenated and deoxygenated blood. That is, the left side always carry the oxygenated blood and the right side carry the deoxygenated blood. Then it increases the efficiency of oxygen transport. Then about cardiac cycle, it lasts about 0.8 second. And then the closure of the AV valves, that results the lub sound, bicuspid and tricuspid valves. And then dub sound, it is by the closure of the semilunar valves. And then the cardiac cycle consists of what? Atrial systole is there, and then ventricle systole is there, and then joint diastole is there. Okay. And then atrial systole, it is about 0.15 second, and ventricle systole, it is about 0.30 second, and joint diastole, it is about 0.40 second. So thus the total duration of cardiac cycle, that is about what? 0.85 seconds. Okay. And then the ECG, the P wave, that is atrial depolarization. So this is the P wave, and the QRS complex, and then T wave. P wave, atrial depolarization, that is atrial systole, and then QRS complex, that is ventricle depolarization plus auricle repolarization also. Okay, that is auricle diastole. And then T wave, ventricle repolarization. Okay. Blood pressure, normal blood pressure is 120/80. High blood pressure, that is called as hypertension, which is 140 by 90. And then the systolic pressure is about 120 mmHg and the diastolic pressure is about 80 mmHg. So the normal pressure is 120 by 80. And then the disorders, the thing we discussed, the high pressure or high BP, that is the hypertension, that is above normal, which is about 140 by 90. Then CAD, coronary artery diseases. It is due to the narrowing of coronary arteries due to the deposition of different substances like glucose, cholesterol, calcium, etc. Then angina pectoris, this is a chest pain due to reduced blood supply to heart. Then heart failure, the heart cannot pump sufficient blood to different body parts. That is called as what? Heart failure.